Earlier this year, Orioles legend Cal Ripken Jr. announced that he was diagnosed with prostate cancer. He's crediting early detection with one of the reasons why he was able to win his battle with the disease. So much so, he is launching a new campaign with his urologist to encourage every man to get tested. And joining us this morning with more is Cal's very own doctor, Dr. Ronald Tutrone, medical director of Chesapeake Urology Research Associates. Good morning. Thanks for joining us.
Thank you, Jennifer. Good morning.
Good morning. Well, tell us about this new campaign you guys are embarking on.
Well, it's a new campaign. It's more of Cal coming out and sharing his story with the public. He thought he could do a lot of good for many men out there. Prostate cancer is the most commonly diagnosed cancer in men, and the second leading cause of cancer death in men. And typically the month of September is known as Prostate Cancer Awareness Month. So it's usually a lot of media hype and trying to get the word out to men and their spouses to get out there and get screened and get detected early.
Well, talk to me about the screening process. It's very simple.
Yes, it is, Jennifer. And it's really just an annual exam in men. We recommend it in men over age 50, or if you have certain high risk factors like being African American or having a family member with prostate cancer. We recommend earlier screening at age 40. And the exam is simple. It's really just a blood test called a PSA, or prostate specific antigen, and a digital rectal exam, which is a prostate check through the rectum. And that's it. That's all that's involved. And really the importance of the test is doing it annually so that you can track your PSA numbers.
Right. And so knowing your number is certainly definitely important. And because it is so easy to do, you'd think that everyone would do it. But why is it so difficult to get men to get their screenings done?
Sure, that's a tough one. Men are really of the mindset, don't fix it unless it's broken. And the problem with prostate cancer is in most cases you do not have symptoms when you have early stage prostate cancer. So men tend to not want to go to doctors. They're not as good as women at being proactive in getting checked annually. So it takes a lot of discipline for a man to say, I'm going to go to the doctors every year. Many men don't go to the doctors at all till they're age 50 or 60, till they have a pain somewhere. And so it's really, men should emulate women who go in annually and get a pap smear and mammograms and are really good about early detection of cancer. So it's just that men tend more to hide their heads in the sand.
Right. So if you are a spouse or a partner, you really need to sort of give them that push. And then once you do, and let's say you do find something there that needs to be taken care of, talk about how much easier this is to treat when you catch it early.
Sure. There's a lot of treatments, and I won't dive into the weeds on that, but if it is detected early stage, confined to the prostate, the good news is that there's a greater than 95% 10-year survival if you detect it early. So that's the good news. And so it's all about early detection. And it's really being disciplined about getting the blood test every year and tracking the number, because one of the downsides of the number, and there's been a lot of criticism of PSA, is that it's not a great screening test for cancer, but it's the best we have. For instance, in Cal's case, his internist became a bit alarmed because his PSA rose from 2.1 to 2.5 to 2.9, which was not very alarming to me as his urologist. And then when I examined him with a rectal exam, his prostate felt normal. But now we've made a lot of advances in genetics and testing, and we have a lot of other tests that can help us in addition to the PSA. And one of them is a urine-based test called the Exosome ExoDx, and all a man has to do is urinate into a cup. We send the specimen to Exosome, who analyzes it and looks for 3 genes. They then give us a number that if it's below a certain cut point, we can assure men, hey, this is benign or low-risk prostate cancer. You don't need a biopsy. If it's above the number, you need a biopsy. And there's a lot of other blood tests out there. There's a Phi test, a 4K. So we have a lot of additional tests that can help us.
Boy, that's pretty amazing.
And try to avoid uncomfortable testing.
Absolutely. Well, Dr. Tutrone, you gave us a lot of really good information this morning. Good luck, and thank you so much for joining us.
Great to be here, and thank you.
All right, take care. Stay with us. We'll be right back.